Good afternoon, everyone. I want to start by saying thank you again to my friend Doug Ford and to his wife Carla. I want also to thank all the ministers that were with us yesterday and today. We had a productive meeting and we agree on important topics. Healthcare is a high priority for all Canadians, but provinces, they face huge deficit and they are facing structural pressures on healthcare funding. Currently, provinces spend $200 billion in healthcare, and the contribution of the federal government is only $42 billion, which is about 21%. So therefore, we really need Ottawa to do its part financing healthcare in a recurrent and without conditions attached to it. So we need a substantial increase of the Canada Health Transfer. We also need to get more support from the federal government for financing infrastructure, including transit and collective transportation. So in conclusion, after this summit, Ontario and Quebec governments are closer than ever. Doug and I are closer than ever. Probably become Habs fan very soon. We have a lot in common. We fight the same pandemic in the same Canadian context. We share the same urgent need to find a lasting solution to finance healthcare in this context of large deficits. We share the same need to relaunch the economy. Working together closely may just help us. So we are stronger together. Merci. Thank you.
And as a follow-up, this is for both Premier Ford and Premier Legault. You're joining forces to call for more money from the Fed for provincial health care. If you do get that money from the federal government, what specifically are you going to use it on to help with the potential second wave?
But I think it's not directly related to the second wave or to the COVID-19. It's a problem that we're facing since many years. Many years ago, when I was Minister of Healthcare, I remember having discussed that with Tony Clements, who was at the time Minister of Healthcare in Ontario. So it's not a new problem, but it's a problem that is increasing every year and increasing because of the expenses related to the COVID-19. But because of the aging population, because of new drugs, new technology, we need more help from the federal government if we want to, we have to share the burden of this special increase, the only expense in both governments, province and federal, that is increasing faster than revenue.
The federal government has already pledged $19 billion for Safe Restart, $2 billion for education. They're facing a $343 deficit, we think. What is it realistic to expect that they will be increasing federal health transfers in that economic context?
Okay, the first thing we have to understand is the difference between recurrent and non-recurrent expenses. Most of the expenses that were done by Justin Trudeau since 6 months were non-recurrent expenses. Now, if you hire more employees in the healthcare system, it's not a non-recurrent expense, it's a recurrent one. So it's very nice to say, thank you for the check for this year, what do we do next year? And we know also that the problem is increasing year after year because of the increase of 5 to 6% on a total budget of $200 billion. So it's a lot of money. So what we're asking now to Mr. Trudeau is, what about next year, in 2 years, and 3 years from now? What do we do with this problem that was there before the pandemic?